Medis endotracheal tube with AccuCuff user manual. Preparing items. Endotracheal tube, laryngoscope, stylet, dental pad, lubricant, syringe. Clean the patient's mouth and pharynx. Take out the foreign matters in the patient's mouth in advance, such as dentures and so on. Check the laryngoscope. Check the cuff leakage. A. Use a syringe to inflate the cuff through the pressure indicator. Align the syringe with the inflation port and rotate 90 degrees forward and to the right, then push the syringe rod to inflate. B. Meanwhile, observe the position of the black ring on the pressure indicator and stop the inflation when the black mark is in the green area. C. Rotate and pull out the syringe, then gently pinch the cuff 1 to 2 times, and observe whether the black ring returns to the green safety zone. If it can return, the cuff is not leaking. If the black ring can't return to its original position normally and stops between the green zone and the white line, or on the white line, it can be judged that the cuff is leaky. At this time, the endotracheal tube should be replaced and tested again by repeating the above mentioned steps. D. Rotate and insert, rotate 90 degrees forward and to the right, the syringe into the inflation port to deflate. When the black ring is on the white line and stable, deflation is complete and the pressure is negative. Rotate and pull out the syringe to finish the inspection. Insert the stylet into the endotracheal tube. Lubricate the tip of the ETT. Body position arrangement. Let the patient take the supine position. Lift the chin and push the forehead and make the head backwards as much as possible, so as to make sure that the lens and the trachea are aligned with each other. Expose the glottis. Open the laryngoscope. The operator can use the thumb and index finger of his right hand to open the patient's upper and lower teeth, mouth and lips, and then use the left hand to grip the laryngoscope handle tightly, and sends the lens into the right side of the patient's mouth and push the tongue to the left. Next, slowly move the lens forward along the midline to lift the epiglottis and expose the glottis. Insert the endotracheal tube. The operator uses his right hand to insert the endotracheal tube into the oral cavity from the right corner of the patient's mouth and move it along the lens. When inserting, the operator shall avoid sharp objects such as teeth from scraping the cuff. Next, send it into the endotracheal tube while aligning with the glottis. Then ask the assistant to help remove the stylet and continue to move the ETT forward. The distance between the tip of the tube and the incisor is usually 21 to 23 centimeters for adults. Cuff inflation. Use a syringe to inflate the cuff through the pressure indicator. Align the syringe with the inflation port, rotate 90 degrees forward and to the right, and push the syringe rod to inflate. At the same time, observe the position of the black ring on the pressure indicator and stop the inflation when it is in the green safety zone. Next, make some adjustment to make sure the black ring is in the green safety zone and stable. At this time, the pressure of the cuff should be 20 to 30 centimeters water pressure. Then rotate and pull out the syringe. Fix the endotracheal tube. Take out the laryngoscope and place the dental pad, then fix the dental pad and the endotracheal tube on the cheek. Observe the pressure indicator during the operation. Observe the pressure indicator from time to time during the operation and check whether the black ring is in the green safety zone. When the black ring is not in the green safety zone, adjust the cuff pressure timely as to ensure that it is within the normal range. When the black ring is between the green zone and the white line or on the white line, the pressure is insufficient, less than 20 centimeters of water pressure, and is needed to be inflated more by the doctor. When the black mark is between the green zone and the red line, the pressure is too high, more than 30 centimeters water pressure, and the deflation should be carried out by the doctor. Steps to pull out the endotracheal tube. Deflation. Align the syringe with the inflation port. Rotate 90 degrees forward and to the right to deflate. Observe the pressure indicator. When the black ring is on the white line and stable, the deflation is complete. Pull out the endotracheal tube quickly and gently. Manufacturer, Tianjin Medis Medical Device Co. Limited.